Nigeria at the year court with the intention to jail some of our members because we realize that national health insurance also the car. And as the same national health insurance, SNIT also the car. These monies were not forthcoming. We are not getting the head and tail.
Okay, so national health insurance scheme and our authority. SNIT for the one car.
And then make a trail.
How? Breaking it down, mommy.
Okay. By law, SNIT, whenever they take money from the public, that is SNIT contribution. They are they are expected by law, say almost the 2.5% at the Command National Health Insurance Authority.
Okay.
Now that is not forthcoming from SNIT. Who investigation who say they are not paying that money to National Health Insurance Authority as expected of them far back 2021.
2021?
Yes, way.
To date,
we know what we are talking about.
SNIT 2.5%.
Yes.
Ya mo ajifi ye hono.
Exactly.
Ya ese omutuama National Insurance Authority no.
Exactly.
They don't pay.
They don't pay it.
More evidence.
Your evidence. Anyhow, but we have evidence.
Okay.
Would I say you call it?
Okay, yanko.
Good. And at a point, Adena Yabresu, and we petitioned Parliament, and the Parliament referred the matter to Select Committee on Health. Say you can do whom come on. And we went to Parliament. SNIT was called. The Director General was present at that meeting. Ministry of Health representative was at that meeting. And they call Controller and Accountant General. They didn't come. They call GRA. They didn't come. And Yang SNIT, Ministry of Health, pet na yedis uncommon.
Okay.
And in the course of conversation, it came to light, say, the Parliamentary Select Committee Chairman, Dr. Afriye.
Are you?
Okay. He mentioned categorically, say, Moamudi National Health Insurance car, Montoya, and you are now taking the people who NHI is supposed to pay to court. Ombeye de Atuyamuka. You owe them. Then they came out to say that, say, Controller and Accountant General has not paid them, and that they were also not able to pay. And
so I said Controller etua
SNIT.
Asana SNIT etua NHI. No money be etua momoka.
Exactly.
Okay. And
GRA is supposed to transfer the money to the consolidated fund, and then it will be released to Controller and Accountant General. One who chain.
Okay.
One who chain.
Okay, so give me the chain again.
The chain is
from the consumer level. Give me the chain.
Good. The National Health Insurance Levy. GRA received that money from the entire public. And SARS Kano cost straight to the consolidated fund. So through consolidated fund, then they have to disburse it from the consolidated fund. And see, straight it has to go to the National Health Insurance Authority. That is one leg.
Okay.
Leg one.
Yeah.
Then leg two. SNIT contribution.
Yeah.
Employers, private companies, public sector workers, all put together. It is mandatory, sir. SNIT will take 2.5% of SARS-CoV. Now what the National Health Insurance Authority.
Okay.
Now, Yasamni said, even if the government one is not coming, why are you not transferring the private one? Because the UC controller is not giving you money from the government institutions. Omuti 2.5%, it's not forthcoming. Where are you not transferring the private companies? There are a lot of private companies, including yours here.
Yeah, they are paying.
You are paying. So why not transfer that one to NHI so that we know that you are up to duty, except that somebody is not working.
No, I say controller na releases kanama Senate.
Exactly, from the public sector.
From the public sector.
Good.
So, a back consolidated fund no more. I say controller na releases kanama Senate.
Debbie. Mami Sanchez.
Yeah, me pe chain no chain na peno.
The chain is we have two main streams. Stream 1, and we direct receipt. Echo GRA from port to GRA. And it's Sasikano. GRA will have to send it to the consolidated fund.
Okay.
And we are direct.
Okay.
Good. If it hits the consolidated fund, government will have to release that money to National Health Insurance Authority. That is leg 1. And a leg 2 ni say the individuals, companies, private companies, you pay direct to SNIT. And SNIT has to pay that money also direct to NHIA.
Okay. Now, I have a controller, controller, where? I have a mobile.
Omo Abayejuma.
Okay.
And Nuna controller.
Okay.
But for the private companies, it goes direct.
Okay.
To SNIT.
So you know, Abayejuma side don't say Emba.
And we have somebody say Abay there Emba. What about the private one? That one too you are not paying. So why are you just blaming somebody for nothing? Yeah, somebody. And the chairman categorically stated, say, you don't have the moral right to take these victims, your victim, they are your own victims, to court.
Here providers, no?
Yes, we are the victims of all these circumstances.
Say I can't provide us. I am say
we are talking about hospitals, clinics, maternity homes, private pharmacies that are providing services to the NHIA. We are all put together as providers.
Oh, okay.
And it's for example, Nyaho is a provider.
Okay.
But I don't think they provide to National Health Insurance.
Really?
I don't think so. Even SNIT
Hospital.
SNIT Hospital. I wonder if they provide National Health Insurance.
I see.
It's an interesting development, my brother.
I see.
And those of us who
that's the first time I met you as a way.
Go and do your investigation. I doubt. Ebia, take your health insurance card there and see whether they will accept it.
SNIT Hospital.
You see for health insurance call and see whether they will accept it or otherwise.
Anyway,
if they accept it, fine.
Yeah.
Good. Now, so when we got to this level, now you catch almost say no. Baby, I hear there, I to mean consubium until something is done. Until we got the police permit to go and do the picketing. You know, we are in a global world. So the authority got hint of the information and they extended an invitation to us to have an emergency meeting. At the meeting, we made it categorically clear. We had a meeting that was last week Friday.
Last week Friday?
Yes.
Oh, after my no interview, no?
Then that was last week Monday rather, not Friday.
Friday, okay.
They got a wind of what we intend to do.
Okay.
They invited us to an interview, how do you call it?
Roundtable meeting.
Roundtable conversation. Now, when we got there, the chief executive, Dr. Okuboy, made it categorically clear, say, he's more than ready to pay, and he's working around the clock to pay. Even around that time, he was trying to pay at least 2 months arrears.
Out of the 7?
Out of the 7. Then we told him categorically clear, say, if indeed you are going to pay, fine, we'll give you some benefit of doubt. So one to be and to within the time framework, we'll still reactivate our picketing. And that one will go all out, nationwide, not only Accra. We'll go nationwide.
Money kind also say.
Well, he actually promised say obey and he mentioned the name Kakra. And as at yesterday, sincerely speaking, some of our members have acknowledged receipt of some monies, and we are monitoring the system.
Sir, man is like maybe 1 month, 2 months.
1 month. Some receive 1 month. Some claim they have gotten 2 months.
So which means sir a year more press release we are na mo senka mo kwako dwam ewo a year NHI no mo anyanko
because they are the promise they give say they are going to pay, and as I'm speaking to you, they started releasing money. We want to give them the benefit of the doubt. But mamiche atre asamba kutre, and I'm so sure say omuntu minye.
Omuntu mintia.
Oh David.
Adenti.
Masa, sisi amenu ka say. When you look at releases of Ghana revenue from the government to National Health Insurance Authority, it is so clear that there is no way they will be able to do that.
Okay, so
now let me give you an example. I'm just giving you statistics.
Yeah.
Now, in 20, just a second.
Yeah.
Good. In 2013.
2013.
Good. A total of 830 million was received by the government.
Mm-hmm.
And they released 492 to NHI, representing 59%.
492.
Yes.
Representing 59%.
Correct. And then 2014. 980 million was collected.
980.
Yes, by GRA.
And
then they released 731.
731.
Yes, to NHI, representing 75%.
75%.
Good. Then in 2015, they received 1.1 billion. Approximately 1.1 billion. Then they released 846, representing 73%. All right?
73%.
Good. Then in 2016, Omaji 1.3 billion, approximately
1.3
billion.
Okay.
And then they released 1.1 billion.
1.1.
Representing 86%.
86%.
Good. And in 2017, Omaji 1.6 billion.
1.6 billion.
And they released 1.2 billion.
1.2 billion.
Representing 77%.
77%.
Good. And in 2018, Omuji 1.6 billion.
1.6 billion.
And they released 506 million.
506 million.
Representing 32%.
32%.
Great. And then in 2019, Omuji 1.3 billion.
1.3.
Approximately. And they released 721.
721.
Representing 57%.
57%.
Great. And then in 2019, Omuji 2.3 billion.
2.3 billion.
And they released 790 million.
790
million. Representing 34%.
34%.
Great. And then in 2021, they received 2 billion.
2 billion.
And they released 127 million.
127.
Representing 6%.
6%.
Yes.
Hey. Case na your case.
Case na your case.
6%.
6%.
Okay, 2022.
We are working to get that one.
That okay.
It hasn't come yet.
Hey. So
based on this trend, that is why I am saying Ebeyedi. I am not speaking out of vacuum.
Na. Until there, I can almost tell the presidency, no. Okay. I mean, it's public knowledge.
Assembly say.
Because that is what they said. Somebody called presidency for operations. That is what they said. Official.
Well, if that is what they are doing,
that is what they said. It's official.
Very good. But you see, Onia, asamu wa mama yenka na ye free.
Catch it.
You see, if say a problem with revenue, and you have a huge expenditure. And Nutre said you have to look for sources of revenue to support your expenditure.
Yes.
There were a series of times I make say they should bring the toll levy back. Asemi edebia meka nipa ntiasie. I am not saying it for any malicious reason, because it's a very good source of revenue to the state, whatever the case may be. Say highways M-Pesa asikana omufaka health insurance ikano ebe because if they are taking that money, when I did the statistics some few months ago, I realized in a month they take not less than 1.8 billion cedis. And it's
from the road to.
So was asika for a period of 4 months, private sector healthcare facility would have been paid out of that money. And to baby yendru. All right, you cancel that one for free. When you interview drivers, they are not averse. Omu ni problem say they pay levy. They told the tone they are not averse at all. So why are we worrying ourselves? Cancelling source of revenue and increasing our expenditure. What kind of economic practice is this? There is no way. You can't go forward. This kind of economic analysis should tell you that if you are spending, you are not getting money, there is no way you can survive. It doesn't happen anywhere in the world. And I am wondering what kind of economic policy is this, practice is this.
Yeah.
And ye part about you, say, they should put everything aside, reinstate that, and give it to National Health Insurance Authority. And then we will continue to provide quality healthcare services to the generality of people in this country. So Uber Health Center more.
Yes.
Mamika Sembicho.
And
there are issues. The issues ni say every facility via our health center no is mandatory. Say you need to have what you call essential drugs. Sometimes who are honor ubia collapse.
Essential drugs na ebini dia.
Uda meba ho.
Okay, yo.
Ubia collapse. Ayedinabe or hospital. You need to resuscitate Sanipano. So one to me and yes, sir, then you have to refer. If you don't have the equipment, the facilities, or all that it needs, you have to refer Sanipano to another facility that has the services. Now, if you don't have the money to buy the drugs, okay? For example, you need nebulizer. Somebody comes with a attack. Okay, you need to use that on the person. You don't have it. You don't have the money. Ube there resuscitate Sanipano. And nothing I call health insurance in 2021. Ne call who Madam Selby Lydia. Ye catch any say, baby I drew there. Asema ya di. And she admitted, say, Yesika womutu no. About 90% is coming from them. And see any delay biano at the assembly ebreye. It is in the press release quoted. I mean that is her own statement. We made advance to her, and she admitted it.
And also say,
but you can.
I was say 4 pages. So. Point 2, Ghana Revenue Authority GRA Parliamentary Select Committee on Health. National Health Insurance Authority. Which one? The quotation was here. Then the planned packeting. Okay, no, it's here. That's point 1. Social Security and National Insurance Trust. Okay, so I read.
Yes.
On the 20th October 2020, the association petitioned the National Health Insurance Authority to intervene on adverse impact of SNET penalties on the operations of the private health facilities in the country. In the letter dated December 17th, 2020, addressed to the Director General of SNET by NHIA, signed by Dr. Lydia
Selby,
and copied Private Health Facilities Association states, and we quote, As you may know, about 90% of internally generated funds of private health facilities come from the National Health Insurance Scheme.
Exactly.
Therefore, delays in reimbursements of medical claims by the National Health Authority to these facilities adversely affect their business operations. Consequently, they are unable to pay their employee SNED contributions on time. Unquote.
Yes. So,
yeah,
good. So on this note, so one to me and to Anipano, how do you expect the person to work for the period of 7 months when you are holding 90% of his revenue? How do you expect the person? And now, when you go to hospitals, you hold your health insurance card. The facilities will tell you do a top up. So top up no, and also had any problem because there were times our prices, medicine prices, the National Health Insurance will give you a price that this is what you have to take. But for example, whatever, let me just mention any drugs specifically on the list. Okay. If you give that drugs out, okay, the price is 40 cedis. Then you go to the open market, you buy it 70 cedis. All right?
Yeah.
The difference of that 30 cedis, okay, is a loss to you before you even give it to the patient. Multiply it by 100 people per day, per month, per 6 months. You can
12 months.
Yes, you can operate. It was just recently they have done some adjustments to the price list. So we were also taking the top up so that we can go and buy the drugs back. And the public did not understand. And we have to be explaining. The beer you have to explain, say, what NHIA is paying wasn't sufficient. And the drone mawa yen to mean koto drone besi hobium. Because I can't go and buy 40 cedis and give it to you
30 cedis.
30 cedis.
Debbie, Mefaka.
I mean, you can't buy.
Obia sent me a message. Was it Coco Clinic? NHIS is not working.
This is SNEET.
So Ceciano. Okay. Oh, that's also.
Wow. So if very powerful state institutions, Omunji health insurance, is health insurance Satan to them?
But Ceciano, currently you are private health facilities. Your providers are Omonye national insurance card. Omonye.
Yeah, we have some.
Really?
They are not interested. Some few ones are not interested. Just that I cannot mention their names.
Yes, of course. But you know them.
I know. And they are part of our group, but they are not interested.
but mono kasa.
Oh yeah, kasapa.
And what are they saying?
They are not interested because what NHIA is paying them, they cannot survive. But you see, why some facilities are still on, they said, the entire nation has gone health insurance.
Yeah.
And it's a crazy baby. Unye health insurance. You are giving problem to the people who reside within your community.
So what's a crazy baby?
Baby. Tisa uko nandoli nandom. Government hospital ni ho. Private hospital nkwane wo ho. Nipa na wo ho no. Okura health insurance we niska. Oyare obeden. So we are doing more than humanitarian services to the people of this country than you can imagine. There are places ukwa there is no public hospital, government hospital, be anyhow. It is only in a private facility that exists over there. And we treat private facilities say now see or closing down. What happens to the people within that area?
Assembly is serious.
No. What happens to the people? Almost those remote areas of the country. I mean, the health sector is in serious trouble, Unia,
How serious? Tell me.
No, it is serious because Enra near AC or Parliament no near AC or Parliament. Near AC or Parliament. We can say vaccines for our newborn babies.
Yeah.
Will come in 3 weeks' time. What happens to kids that were born within today up to the 3 weeks' time that Yebenya vaccine? Here, we will come back to a state where we have a lot of polio cases.
What is happening to Yenya vaccine? What is happening?
Can that be attributed to improper management? Lack of foresight? Because Unim said at the end of every day, Biano, kids are born in this country. You have to give them vaccination to prevent certain diseases that are childhood diseases. And you know this. And you are telling us in this country that vaccine is not readily available. And
I think that this is the first time for almost years.
Can I use the word unprecedented?
Really?
I mean, Assembly said, because if that is not readily available and kids are born, people take their kids back home and they don't take them back for vaccination after a certain period of time, and something happens to that kid, who should be held responsible? So somebody sitting somewhere must be held responsible for these sort of actions.
But it seems I buy no two as I say we find light as a issue a big deal.
It is a big deal. It is a big deal. Big deal because today, who say a problem? If we begin to see how do I even put it? Children with their legs going wayward, there you begin to see that we didn't do well.
No, because also a buying approach is like, I don't care.
You don't care. You will soon care.
No, because the president, the vice, the minister, DC, MC, they have a way. I mean, they can do, but that is where the problem is. And in fact, they don't care.
Yes, you see, if you recall,
yeah,
years back, polio, if not entirely eradicated, eliminated to a very large extent, and you only see an adult with polio cases, but for children, no. But what we are going through, CCN, and polio cases coming up.
So which means the health sector is breaking down.
It's in a serious trouble. I use the word, didn't you hear, my brother? The health sector is in serious trouble. You see, under normal circumstances, the health minister is supposed to be the next in command, if not mistaken. After the vice president.
Yes.
The health minister should be the next in command. Because you are taking care of the entire health systems of the country. And you must be here responsible for some of these petty things. But Sisi Ayeka say, it is never the case. And we are in a serious trouble, my brother. We are in a serious trouble. And I think something must be done as quickly as possible.
Because this is the situation. Even yesterday, almost from to Parliament, they did not show up.
Yes, you see, say your friend said, whatever the case may be, it is nice to say, okay, we have made requests from the international community, say they should give us ABC. For some reason, it has delayed, but we expected that within so and so time, we are going to get this. And then they should also give us measures they will adopt to go to the community to vaccinate, or even call the children, their parents, to bring them for vaccination within a certain time frame. Kids that were born. All these things must be well planned to the extent that no kid will be left out after you have been able to, get the drugs. Okay? But here we are. No information is going forward. Nothing is happening. People are taking their kids home. As to whether the kids, they will take the kids back to the various hospitals for such vaccinations, we don't know. And that is why, premise on this, that is why Meka say the health sector is in serious trouble.
Apart from these issues, other issues are pressing or more other issues apart from this vaccine issue.
No. I personally wouldn't want to go into their domain, except what has come to the public.
You are a Ghanaian.
I am a Ghanaian, but you see, some of these things.
And we rely on professionals like you to understand exactly what is happening, so that yes, you bet him the media now because as I sit here, if you cry now, me village, me cousin be anyem ya or babeo, Akulan can be affected. Me think how can I know? So then I need to join. Next year, ye
Onya, Sisia Meluka say, we need to be extremely careful. Our planning system must work. This is all I have to say. We need to plan, do a lot of strategic planning to the extent to say, when you know that you have a stock of a particular drugs that is very essential to the people of this country, you must make sure that at the end of every month I spend or I use so and so number. So you need to have a buffer, so that even if from the international community you are not getting it, as you are pressing down, by the time it comes, you will still have some to be administering before Niawu requesting ebeba. But it is not working like that. So at the end, say nobody cares.
BC
Basa, nobody cares. Ken
Farouk has sent me a message on your Facebook page. Or said, I mean, Bobby, the simple truth is that the NHIS, I mean, it's collapsed. On any argument.
You see, honestly, the current state of affairs, as far as NHIA is concerned, is not completely collapsed. The current state of NHIA is not, completely collapsed. I bet to differ with him to some extent.
Okay.
Now, why I'm saying this is that the current leadership, okay, to a very large extent had been forthcoming in terms of, making sure that we understand what the situations are. No, we push them to the wall. Seriously speaking, the last time we told them we are not going to listen to anything. They have to beg and beg and beg. And we say, okay, fine, we are giving you some respite. If you are not able to meet that standard, we are going back to the system. Share Maminka Bibichro.
Okay.
Sisi Aminu Kasai. Take it or leave it. There were a series of agitation from other people say the private sector should be out of the public health insurance.
As providers.
Okay. So that we don't provide to the public. I tell you, they should try it and see how the system Ghana will look like. They should try. That has been the propaganda they have started, because they have come to realize that the private healthcare facility providers, they have become very powerful to the extent that they speak to issues as and when it comes up.
Propaganda.
Oh, Unia. Almost they should remove all the private. Before me they should take all private hospitals from the national health insurance. Yeah, there is any problem.
Yeah.
Any problem. There are places you don't have government hospital. Only private hospitals you have there. With your uniform nation ABC. So you see, when it comes to the issues of mismanagement or inappropriate management of the system, then you think that because the private sector is demanding so much from you and you have to kick them out so that they don't even talk to the issue. This is what is coming up. Because nima aseme aye mini wo kan sisi aye ntuminka enti ni ebe kosu e wo health sector krampo a hu any ochina. Who are you in the public sector to go and talk say government is not paying, government is not doing it.
Okay, so the likelihood say omo pia mo sinchen na come the government for nkwa no ni aso mene
enu that is what the situation is.
And so we call government hospital don't me access sebia affordable friends health service so call private obako private no so no nebo ayedin
I just say nebo ayedin we are providing services to the extent, say, anybody can access it. The question is how much are we paid? The variation is not anything so huge. What you say? And we pay our salaries, we pay our utilities, we pay everything to our members of staff, and yet we continue to provide service. What you say?
Yeah.
And the agitation say yen private sector ni frame na ebeka only government institutions no. They should try it. Yeah, there any problem. They should try it. When they do, Ghanaians will see. Ghanaians will see. I remember it was the private sector that took the bold initiative under President Kufuor to bring national health insurance to where it is today. I remember when all hospitals, some major ones, refused, say, omu health insurance, when it was introduced, few of them took the bold initiative to support the system to bring it to where it is today. And today you said they should remove all the private facilities.
Are you here for?
It's your people now. It's your people. They should try it. It's your people. They should try it. We are not much worried.
So the point is, Sikano Mbeji Jombe Timo di Amamone, what a problem na akupiaba.
And no any problem because someone who said Sikana Eco private sector no I had also but I said it is not everywhere you have government facilities. What you say?
Yes.
There are places there is no public facility there.
Only private.
Purely private. And to that you from the
Mame, and dealing with that, a man for Madam Doctor Bia sent me a message. You see, Bobby, in the hospital where I work, those who come with health insurance card are not attended to.
So which year?
Okay. So it says the mafias in the health sector are more than the mafia in the health sector is more than serious. You can't talk. Things are happening, but how dare you talk about it? Okay, so this is from a doctor friend. Jennifer Boache is watching us from Toronto in Canada. Ken Farouk says in Kaswa, all private health providers who are accepting the NHIS before are now rejecting it. People with NHIS cards are being turned away. So Kaswa is a typical example. Now Emmanuel Lechu, I say, Nadamfu Pando, he went to hospital like 3 days ago. Man in Russo on top. When you don't be on so the nurse will send this scanner to him to buy the medicine and send it back to him or Pando. Is it possible?
Yeah, it's possible.
Is it possible?
It's possible.
How?
Okay. A drone be wahwa. Any health insurance list no so.
Okay.
Any list no so.
Okay.
And it's sad drone niswa. Then there is nothing we can do. We can't give it to you. Say the more cry, so bet you aka.
Okay.
Because health insurance no our list. They have all the drone. Anybody who comes with the reference to a particular health conditions no bet me at the man.
Yeah.
And I be so any health insurance list no so. And he said doctor prescribes a drone mawa. He said you have to pay for it. So that is outside the health insurance list.
Okay.
And there were instances where sometimes this is say American first.
Yeah.
That the drug is 40 cedis. Health insurance is paying 10 cedis. The difference of 30 cedis must be paid by somebody so that we can continue to maintain the facility. And no top up now in the past, you know. But you see, I know there has been some changes in the prices.
Okay.
And I think things are getting better as far as the pricing is concerned.
But another issue, among for see a no boy ding.
Yes, it is because of the dollar. You know, apart from few that are produced locally, about 80% of drugs I use in Ghana is imported. And when the dollar is rising, obviously, it has effect on the drugs that are coming in and the pricing as well. So basically, that is it. And when that happens in the open market, Uben who say under no circumstance will somebody go and buy 4 cedis and come and sell it 3 cedis. It doesn't happen in any business sector. At least you will sell it 5 cedis to make a profit of 1 cedi. And the price is going up. That is why the health insurance price it's always lower than the open market price. And when the top up now you can Ebano.
Anyway, live on Accra 100.5 Citizen Show. All right, so ye dim komo ye kasa se yanka bia ma omo dachi bi wachina bi because menu mienu nyina no ye pie ye kota duro menu mienu nyina ye kwa assess ye healthcare na se ye ko me baby a ehia me no meba ho me pese owura frank ewie no kwa no maba ho ye gigisika we nyina 2021 kwaya yaji 2 billion emu 127 million Ghana cedis de akọ di aka no ewe why na first ka no you say eco presidency so sometimes you don't get it one tear the na see e bia just e bia okay so my main screenshot ma kwa me kwache na kwa me kwache ejakwa wi a ye be ho adwuma Uncle Frank. Now, young fan say more packet in there, Yamaso. Is that what you want to tell us?
That is correct.
And the Omatria 1 month, motion and Musom Betia Diacano.
A Bimuaji 2 months.
Say, I must and continue on what next?
Say, I'm Basusa. And they pick it in Bebasu.
But
some then possible withdrawal.
But suppose I say a GBDR, which means provide a beer who can say, Obeka say, Obi de NHIS aban on you.
No. You see, as somebody say, yay, I have set no. Kai say, we have what you call hypocritical oath. Sa oath no, and which say, whatever the circumstance may be, irrespective of your petition, you are mandated to provide healthcare services to anybody via or beba or facility.
Okay.
And it's and which say you can't see a patient and say you will not attend.
But your own doctor friends send me message says say private hospital here Juma and for the bar more normal way every day.
There be once you agree to accept the health insurance card at your facility, you have to attend to the patient.
And they are turning them away. Right now, will be Sunday. Unless say open so catch them say what the normal here what report no.
Report to who?
So, which I don't know, but the point is, it's happening. I'm out for sending messages on my Facebook page, on my private phone. They are sending messages.
Well, I'm here to get that very clear. Because we have agreed, sir.
And the only that will be the NHI card that call, am I attending away that? Won't be that?
Near
Okay.
Nise.
Yeah.
Would you have insurance card bar?
Yeah.
You have to pay for the drugs that are not on the health insurance list. That is number 1.
Okay.
Number 2, if the value of the drug is more than what is on the health insurance list, we'll ask you to pay a top up.
Okay.
Okay. But Koli say we will not look at you there. That one is not part of our system.
I see.
Yeah, we will look at you.
Okay.
We will take care of you.
Okay. I didn't know Ghana for.
Yes, somebody said we expecting government to do the needful. Say wherever the money they received, in respect of national health insurance, they should hand it over to them, so that they can also pay us. The BS Kanekono, they should look at it carefully, because if you look at the statistics I've given you, Obenhun said under this government, greater proportion of the money is not going to NHI. Oh yes, I am not saying it. Records is saying it. To the extent that in 2021 you have given 6% of the total amount you receive to NHI.
That is too bad.
In the name of what? Meanwhile, it is the National Health Insurance Act that mandated the collection of that money, and you refuse to give that money to the very institution for which it is established to collect that money for its activities. And also you're there.
Is it true, sir, drugs are providers in the microphone less effective? Is this true?
You see, the National Health Insurance Authority has given us the drugs to administer. So we call it health insurance drug. We call it health insurance drug. Now, in the health sector, you will be your friendly generic and branded. What you say? Generic and branded. It is a original copy and photocopy.
Okay.
Generic and branded. And the branded products are more efficacious or more powerful than the generic.
Yeah.
And we give generic, and those who have the money and want to buy the branded, they buy the branded.
I see.
Yes.
And really be effective.
Oh yeah, that is a fact. And there are instances you can use one drug for a long time before you get healed, and there is the same condition you can use another drug which is a branded product, and within a short period of time you get recovered. That is what the situation is. I think what you say.
Yeah. Obi and them will say generics are less expensive drugs. Okay, so
exactly.
so all right.
Exactly.
Okay. Uncle Frank, Accra FM Citizen Show. Omo Central Region any Tamale. Any baby I saw that's baby.
Yes, we are.
Say wabe near Masodia Mom. Thank you so much.
Yes, we are.
All right, so that's it live at Accra 100.5. Na Kwame media you not send. Okay, so Kwame Fatwa say mame. Fatu me page your mame. Thank you, sir. Thank you so much. Okay. All right. Okay, so Fatu mame. Now, more a Facebook page. Sir, obi wo on Chenya be mani hebi. So obi wo on Chenya be mani hebi. Enti asem ni nie. So one to share crown. We need to start asking the government. Na sikano wa hen. Said the Akufo-Addo busae no. Sikano e wa hen. Hwe eyini nie. Offer 2030.